Hi friends, I am Dr. Manjushri, Ayurvedic physician from Surathkal. Today I will let you all know about breathlessness. What is breathlessness? It is a feeling that everybody will experience in their lifetime, one time or the other. It is an unpleasant feeling, it is an uncomfortable sensation of rapid breathing. So, the person who is breathless says that he is puffed up, he is winded, and so on. It is one of the causes for which the person calls for an emergency ambulance or is admitted in the casualty for an emergency. So, this breathlessness may be acute, that is, it develops suddenly, or it may be chronic, that is, it is since a long time. So the normal breathing mechanism is, as you all know, we inhale air to the nostrils which gets into the lungs, and from there the oxygen rich blood is pumped from the heart to all the parts of the body. So the breathless person's body needs more oxygen. As a result, he tries to breathe faster and faster, and hence the breathlessness develops. Breathlessness can affect everybody when they exercise, especially if they are overweight or if they are unfit. Some of the causes for breathlessness are asthma. The asthma is a condition wherein there is rapid breathing and the patient has a wheezing sound, and it can be triggered by an infection or a cold or an allergy. Next is the pneumonia. It is a severe chest infection where the patient has high-grade fever and he expectorates a greenish phlegm or a sputum, and he has a cough along with it and he is severely ill. Another is COPD, that is chronic obstructive pulmonary disease. It is a long-term condition wherein the airway becomes narrow and it causes this breathlessness and the cough. The airways becomes narrow and it actually worsens as a result of infection. Another another disease or another condition where we can see this breathlessness is heart failure, wherein the heart doesn't pump it properly and pressure builds up in the vessels, and this pressure makes the fluid build up in the body tissues. Some of the pulmonary embolism and some medications also cause breathlessness. Anxiety. Anxiety can cause breathlessness, panic attacks, sweating, and palpitation. Pain and anemia are also the causes for breathlessness. Anemia is a condition where there is reduced hemoglobin in the blood. The treatment. Now coming to the treatment aspect is, the treatment will depend upon the cause. That is, if the patient is suffering from asthma or COPD, or if he is suffering from pneumonia, then he has to consult a pulmonologist. Whereas if the cause is because of heart failure, then he has to consult a cardiologist and a physician if it is any other causes. So when we go to a general practitioner, he will guide us as to whom we should consult. Depending on the condition, the treatment will be given. The other way to effectively manage this breathlessness in Ayurveda is pranayama. Pranayama means regularized controlled breathing techniques. One of the easiest exercise which a person can do at home. So in pranayama there are different types, but the easiest and the most commonly done pranayama is right nostril breathing. That is, the person inhales through the right nostrils and exhales through the right nostril. Another is the left nostril breathing, wherein the person closes the right nostril and breathes in through the left nostril and exhales also through the left nostril. The third is alternate nostril breathing, wherein the person closes his left nostril and breathes the right nostril, and then he exhales through the left nostril, keeping the right nostril closed. By doing these techniques at least 5 minutes a day, the person will have a control over his breath. Whatever it is, even if it is in an acute stage, do not panic. Use your inhalers if you are an asthmatic, or you can use if you have an oxygen puff at home, or immediately consult your doctor. Health is wealth. Stay fit, stay home, stay happy, stay safe.